Another top story tonight, a Johnson City Medical Center nurse is back at work after a grand jury indicted her last month on charges related to drug diversion. Not only is her employer standing behind her, Mountain States Health Alliance's chief nursing executive told Nate Morabito helping recovering nurses return to the workforce and be a part of the community is, quote, the right thing to do.
Several viewers reached out to us wanting to know why Kimberly Click is back at work. We obtained a hospital schedule that confirmed her continued employment. Mountain States wouldn't talk specifically about her case, but did direct us to Click's licensing information, which shows her nursing license is on probation with strict monitoring that allows her to continue working with patients, even with a criminal case pending. The same state licensing records that show this Johnson City Medical Center nurse admitted diverting opioids 2 to 3 times a day gave her the chance to return to work as long as she entered a monitoring program for the next 3 years.
It's a disease, and there's stigma around that.
Mountain States Health Alliance Chief Nursing Executive Melanie Stanton says the health system is doing its part to fight that stigma.
And it's the right thing to do.
Helping nurses who are battling addiction on a case-by-case basis by not giving up on them.
Bad things happen to good people, and it's like I said, it's very, very important that we also manage the disease, because that's what we do in healthcare.
All nurses in recovery with the Tennessee Professional Assistance Program have strict restrictions.
While they're in the program, they do not have access to the narcotics, so the risk to the patient is minimized.
And must pass random drug tests, attend support group meetings, and comply 100% with the program, or else face possible license suspension. Stanton says a pending criminal charge doesn't change any of that. She says what really matters is the competency of the nurse, their work history, and their willingness to participate in the TENPAP program.
If they are good citizens and participants of that program, we continue to work with that nurse.
The Tennessee Nurses Association created TENPAP decades ago as an alternative to discipline.
The theory was if you could get a nurse in recovery from this disease and monitor them very closely, they would be safe to return to practice, and you would save a nurse's license.
The organization's executive director reports 78% of the medical professionals who signed monitoring agreements over the last 7 years successfully completed the program, which he says means a minimum of 2 years of consistent documented sobriety. In the meantime, he says the number of relapses continues to decline, down 60% statewide over the last few years.
If they do relapse, we immediately take them out of practice to protect the public, and we would notify their supervisor.
Back in Mountain States, Stanton says the health system is now better than ever at catching employee drug diversion early, which she says leads to a higher recovery success rate and a safer environment for patients.
Should they not prove to be a safe, competent nurse, then we will terminate employment.
Take a look at this chart here. The TENPAP program reports 330 medical professionals statewide, most of them nurses, are currently taking part in the monitoring program, with 16 referrals coming from the Tri-Cities region in the last year alone.
Nate Morabito with an update tonight. Thanks, Nate. President Donald Trump is officially declaring the opioid crisis a national emergency. President Trump made the announcement late this afternoon. A drug commission convened by President Trump recently called for a national emergency declaration to help deal with the crisis.